Okay, everybody. Thanks for tuning in. I am Shane B. You're watching Talk is Cheap with Shane B. The purpose of this show, we're broadcasting live on Westerly Life and Westerly Live. The purpose of Talk is Cheap is we're talking with people who are taking action during the COVID-19 pandemic. Last week, we had Dr. Mark Garceau of the Westerly School Department, the superintendent. And this week, we are speaking with Dr. Oliver Mayorga, who is the Vice President and Chief Medical Officer of Lawrence and Memorial Hospital, as well as the Westerly Hospital. So let's dive right into this. Ben, can we bring Dr. Mayorga into the interview? There he is. Dr.
Good morning.
Mayorga, good morning. How are you?
Good, I'm well, thank you.
Thanks. Thanks for taking the time to speak with us at Westerly Life. I know you're a busy man, so we really appreciate this.
You're welcome.
All right. So the biggest question, because we haven't really spoken to many medical professionals locally, so that's why we wanted to do this. And who better to get one of the men in charge, to talk to us. So the big thing, how is the Westerly Hospital preparing itself for what is potentially coming down the road?
That's a good question. First of all, thanks for having me on the show. I try to take every opportunity I can to get the word out to the folks out there, because there's a lot that you might be hearing in the news and the media, and lending some semblance of local flavor to it is extraordinarily important. So I will also share that I'm also an ER doctor, so I know exactly how it feels to be on the front line of this war, and I've worked at Westerly for years as well too. So
oh, great, thank you.
Yeah, so I think, to answer the question of what are we doing to prepare, we are actually working very closely with our partners within our health system. And as you know, we're part of the Yale New Haven Health System, which is 7 hospitals strong. And so we're not in this alone in Westerly. And also we're part of Rhode Island, which is wonderful too, because the Rhode Island Department of Health is a wonderful, wonderful resource. They are very engaged, as you've probably seen in her daily press conferences. Gina Raimondo, almost said doctor there. She's probably going to get an honorary doctorate after all this. Gina Raimondo.
Yeah, she's doing a great job.
She is doing a wonderful, wonderful job. And so, what we started doing even, before all this started, when we started seeing that it was hitting the United States, was in Rhode Island, we started taking stock of everything that we thought we would need, including ventilators, masks, respirators, gowns. And so they coordinated that locally in Providence. And so they started tracking it very closely. And when we need equipment, they can actually send equipment from the national stockpile. And so we can talk more about that later. But really what we've been doing locally is just enforcing some of the things that we know work at the hospital level, which is specifically visitor restrictions, which is in line with what the Rhode Island Department of Health recommends. But specifically, those are to actually limit exposure of folks who might have COVID-19 coming into the hospital, or also visiting folks who are coming into the hospital to see patients who are sick with COVID-19 from actually picking it up. So that's one of the first things we did.
Okay. So visiting hours, have they been altered, or is it back to normal? How is that working for
No,
patients?
It's still in effect. We call it level 3, which is actually across all hospitals in Rhode Island, actually. And so what it means is it's a restriction essentially to all visitors, except for certain circumstances. End of life care. It's important to have your loved one there. And also there's certain cases that we look at on an individual basis where we think a family member is necessary for the care of the patient. So it's not absolute.
Okay. Now, a big question is how does the hospital prepare for something like this? You can never know what's coming down the road, but how do you best try and figure out what you need to do when something like this does happen?
Well, the good news is we're not making it up as we're going along, which is always important to highlight. We have been through and prepared for pandemics before. So most recently, Ebola, as many are aware. Also, we had another coronavirus called SARS. And we also had, H1N1 back in the day, which similarly helped us prepare for this. Of course, the COVID-19 is different in terms of the number of people that could get infected and how sick they can get, but the general principles are still there, meaning you need to actually prepare for a large surge of patients who need healthcare and certain types of healthcare, like critical care, which is the highest level of medical care, to even just regular care like oxygen that can be delivered in non-critical care settings. Trying to manage the front end is what we call the patients who are coming to the hospital is extraordinarily important. So you'll see we are working to put up a tent that is near our ED so that the emergency patients who are coming in, if we get a sense that they might have COVID-19, we can actually immediately direct them to a safer location. Because part of any pandemic control is actually managing people coming into the hospital, and then appropriately putting them in the right location in the hospital so they actually are safe and not spreading it to other patients or healthcare workers.
Okay, I see. Well, that brings up another good point. How do you manage the healthcare workers and manage their safety through something like this?
So healthcare workers are our most valuable resource. I'll say that not only because I'm a doctor, but because it's absolutely true in this case. And also
I agree.
Westerly being such a community town, most people have relatives that work in the hospital. And so, what we are trying to do is absolutely keep our healthcare workers safe. And one of the main ways of doing that is with what we call PPE, which is personal protective equipment.
Okay.
But that includes really anything from masks to respirators to gowns to gloves to goggles, anything that you would wear as a healthcare worker to keep yourself safe when you're taking care of a COVID patient is what falls into PPE. So we very much push out communication regularly to the frontline staff so that they understand what level of PPE they should be wearing for certain patients. Because the other fact that might be out there, and many of your viewers probably know this, is that there really isn't enough of PPE currently, partially because there's so much COVID in the United States. And then secondarily, many of the factories that produced the PPE actually were in China and they were shut down when they went through COVID. So it's kind of a perfect storm. So we're doing our best to protect our healthcare workers, but also make sure we don't waste the valuable PPE we have.
Right, we're now seeing that stress on the global supply chain for everything, and especially with the PPE now. So one big question I know I have, and a lot of people may have as well, with the mask. Uh, does the mask? I know there are certain levels of masks.
Mhm.
Now, the mask that people are wearing, the surgical masks, do they actually do anything to prevent the spread of the virus?
That is a tough question to answer easily. So I will do my best to keep it straightforward. So when we look at masks, really what it is, it's something that covers your nose and your mouth. And the goal of it is to, in certain circumstances, prevent droplets from hitting your face. So say, for instance, if someone sneezed on you, the mask would help prevent that from actually getting into your mouth.
Okay.
I highlight that because we know that viruses like COVID very often are transmitted through mucous membranes. So, your mouth, your eyes, you can actually get it that way. The fact of the matter is, most of the data shows that wearing masks does not actually prevent you from getting COVID, or is less effective than most people think.
I see.
The main reason is we actually tend to infect ourselves when we don't clean our hands and we touch something that has a COVID virus on it. And then later on, when we take our mask off, because there's a certain way you put on your mask and take off your mask.
Did not know that.
And most of the public doesn't know that. Healthcare
Right.
workers definitely know that. And if you do it wrong, what you end up doing is you touch the outside of your mask and then now it's on your finger and then you rub your eye because you're itchy, and that's it.
And
So
next,
there's actually studies that show masks can increase your risk of infection. Now, the one thing that masks do help with is actually preventing transmission of COVID. And so what's not been talked about as much, although most recently it's starting to become something to consider, is if you or I, God forbid, have COVID, and we are not that sick, and we think we just have allergies and we are sneezing occasionally, what us wearing a mask does, even if we think it's protecting us, it truly actually protects those around us, because when you do sneeze or if you cough, it covers your face automatically, and so you're not spreading it. And so there has been some recent discussion to say mask use should be expanded to everybody, but mainly because it protects others, not necessarily the mask wearer. That makes sense.
it does make sense. Okay, great. Now, one big thing, because this virus is so new, is as information is coming in as quickly as possible, uh, what network does the medical community use to get this information out as quick as possible? And uh, is there information coming from the Chinese medical community moving westward to help us deal with what is to come?
Um, yes, there definitely is. I'll answer the last part of that in the sense that communication to the medical through the medical community, worldwide has increased exponentially. Many of the processes for red tape for reviewing the data and what's put out in studies has gone away. Really, it's
Oh, that's
about
great.
it's wonderful. But that being said, you do have to take some things with a grain of salt now too. Before a medical article came out, you would have many people review it and make sure that everything was accurate. Now it is a very early study that might help guide us on, for instance, the use of hydroxychloroquine, for instance, as a medicine, right? Even that has not been proven 100% yet to work. However, there is widespread belief that it could help, and it certainly doesn't seem to hurt. And so we should try things like that. One other point I will say is we are learning from Italy. We are learning from China. Some of the things we learned, we hope we never have to use. So, for instance, in Italy, many may have heard their health system is so overstressed right now. They have to make very difficult decisions at
Right.
end of life, who to save, who to care for, and how many people can they possibly provide care at one time. And many of their physicians are sick, and their nurses are sick as well too. And so what we learn is from them that we have to be absolutely careful in the hospital as to how we use our masks. Like I just said, you have to take them off appropriately. What we've also found is healthcare workers tend to infect each other more than patients infect healthcare workers. So people coming to work who are sick, we can't do that anymore. We have to
Right.
clean our keyboards. We have to clean our computers because even opening a doorknob can actually be risky these days if you don't wash your hands. So we learn about some of these basic rules from our partners who have experienced it. I will also highlight at the same time, science has progressed so far that I would say if this virus had hit us 50, 60 years ago, we would be in even a worse situation. Maybe even like the flu pandemic of 1918 that killed 40 plus million people across the world. So,
Right.
within 3 months, we have sequenced the genome of this virus. We know how it works. We don't know everything about it, but that is something that science has never done that quickly. We also know that the virus, it's not just one virus, it's multiple viruses, and that
Oh,
the RNA mutates. And so there's a couple of different viruses out there. And when we see data from China, for instance, that says, 20% of people actually need to be hospitalized, and 5% of those people end up needing, 5% of people who get infected end up needing intensive care. Those numbers are changing, and they're changing because there's certain strains of coronavirus, COVID-19, that act differently. And so we're closely watching how this progresses and very much exchanging information as quick as possible. I think the good thing also of being part of a larger system is Yale New Haven Hospital is one of the world leaders in many things, and virology is one of them. And so in the beginning, a few weeks ago, when we couldn't get enough test kits to test for coronavirus, which is important, one of the leading virologists there actually she made a test kit.
oh,
And
wow.
within about, yes, it was very impressive. And she worked 24/7 to actually get to a point that we could run our own COVID tests in New Haven. And so we actually sent samples from Westerly over there so we could actually diagnose patients.
Oh, that is fantastic. So we're seeing people come together, being very intuitive and trying to figure out new ways to do things. And just like with this test that your colleague developed, that's amazing. Since you brought up testing, let's get into that now because, as the governor was saying, we're going to be testing up to 1,000 Rhode Islanders per day. Uh, can you explain why being tested is important?
Of course. So much of controlling pandemics comes down to public health measures, which are essentially diagnosing or at least identifying people who have the disease. So COVID-19 would be the disease, and then immediately isolating those patients or individuals and making sure that we can track who their contacts are. That's the only way to stop this. And so
Gotcha.
up until recently, we didn't have the ability to identify patients as quickly as we needed to. And those are the tests that the governor is talking about. So she has been able to get more widespread availability of tests, which, to be clear, is not the case elsewhere. Connecticut doesn't have that ability right now. So it is good to be in Rhode Island right now and to have her open up test centers for the public, because the eventual goal, and this is what they've seen across the world, like in South Korea and Italy and even in China, is that you really do have to test everybody, and you probably have to test them again. And then anybody who tests positive, even if you have no symptoms, at least you know that you have it and you know you can spread it, and that will eventually flatten the curve and allow the virus to burn itself out. So it is exciting, and I think just keep a close eye on the governor's recommendations, because I think she is just doing some great work.
I agree. I agree with you 100%. How long does the test take, and how accurate is the test?
The test can take any number of time frames. So there's different types of tests, actually, and it gets quite confusing. But the best test is called the PCR test, which tests for particles of the RNA that's in each of these viruses. That's very specific. Those tests actually are fairly quick, and now they're getting even quicker. So I'm not sure exactly which test the state's going to be using, but for instance, we have recently acquired some test kits locally that can have a turnaround time, meaning after you start running the test to getting the result, of as short as an hour to 90 minutes or so, which is much quicker than we were getting before.
Yeah.
Many of the national test centers actually are getting backed up because, as you can imagine, they're getting all these samples from across the nation, and the turnaround times for some of these large corporations were getting up to 7 days, 10 days, which arguably makes the test, well, not as helpful because a lot can happen during that time frame. So as we see more and more test availability, I think what we're going to see is the time gets quicker. So I've heard of even 5-minute tests that are being rolled out. But it does speak to your second question of how accurate these tests are. Because the tests that are out there now are being released under something called emergency use authorization, and that's a federal approval that says, we know the test isn't perfect yet, but the fact of the matter is we absolutely need to be able to run some tests. We're going to let you go ahead and run these tests, but there's not data to say exactly how accurate they are. So there has been some discussion of the fact that some of the tests are not that accurate, meaning if you have COVID, there's probably a 70% chance it'll come back positive. But that's scary too, because there's a 30% chance that it'll come back negative, which is what we call a false negative. And you still have COVID. It's just the test, for some reason, didn't detect it. And so, you may end up seeing more information about that, because it doesn't mean that you're free and clear just because your test was negative. If you have every symptom of COVID, you probably still have COVID. So it's important to actually share with the public, if you are feeling sick, if you are having fevers and you can't breathe, even without a test, and even with a test result that's negative, you still need to self-quarantine at home and do what you can to recover.
Okay, that's some great information right there. Now, I do have a question about the immunity. Let's say you have been infected with COVID-19. Now, are you immune to that in the future? Can you get reinfected? How does that work?
So we think currently, and we're just doing we're doing new research on that as we speak. And so what we think is this COVID-19, it's a coronavirus. We've known about coronaviruses for decades, and we know how they act. And so there's no great reason to think that this one behaves any differently in terms of immunity. And so similar to influenza, which is our other viral friend that hits every year, we think that there's going to be short-term immunity once you fight it off, which means that for a period, which we're trying to sort out now, of months to maybe even a year, if we're lucky, maybe even 2 years, people who recover from COVID-19 will be immune to that particular strain of COVID-19. And I say strain because we find the same thing with flu. Different types of flu exist, and that's why you end up having to get a flu shot every year. And actually, the flu shot is only as helpful as the strains it was designed to fight. And so on some years, we actually aren't so great at predicting the strains that show up because you don't know 100%. I think that COVID may end up being similar to that. So for the short term, people who fight off COVID will be immune for a period of time, but it's likely eventually that immunity is going to go away, and then they'll probably need another exposure, which hopefully we'll get to a vaccine in the next year or so. Vaccine development is not a quick science, and that's just the way it develops. It's not a money issue. It's just it takes time. So we hope to have a workable vaccine probably within the next year or so, but it's not quick.
That did lead into one of my next questions was with the vaccine. Now, you answered some of the things because of science, but what is the main reason vaccines will take a year, 18 months to be developed and be viable for the public?
Well, the current way they actually develop vaccines, which is how they also take care of or develop influenza vaccines every year, is they actually use a process where they incubate different strains of the vaccine in eggs, frankly. And so you actually have to give time for the vaccine or the actual eggs to develop a reaction to the actual particles of the virus, and then you have to harvest all those eggs and actually try to test then whether the response of the eggs actually is appropriate. And so that cycle of injecting those eggs, harvesting the eggs, testing the eggs, and you have to do it several times is really what takes that long period of time.
I see. So we're pretty much about a year and a half, 2 years roughly away from that.
The most optimistic numbers I've heard is hopefully by next year at this time we'll have a workable vaccine. But you're right, some of the more realistic numbers say maybe a year and a half, maybe two. We'll see.
Okay. So in that meantime, let's say someone has been infected, they've recovered. Now, can they still transmit the virus at that point, or is it eliminated from their body?
They are actually studying how much viral shedding, that's our term for it, meaning how much
Okay.
virus is coming off your body or being shed off your body. It can still be transmitted, we believe, but trying to determine how infectious it is important. And I don't have an exact answer for that because we're still on the cutting edge of science there. So what
Right.
we're finding also is there is probably significant shedding even before you have any symptoms. So that's another concern, and it goes back to why I mentioned that there may be a push to actually wear masks just in general, because if you have no symptoms, you could still be shedding and infecting other people. So,
Oh, wow. So the research and the science is coming in daily, all this new
it is.
information.
It
So
is, and
I'm sorry, go ahead.
I was going to say, and actually, it's important to say we don't know all the answers, and that's okay. And I know the public is frustrated. We as physicians become frustrated too. But this is the cutting edge of medicine, and we are doing the best we can with all the resources we have. But we still don't have all the answers.
Right. Thank you for being honest. That's the best way to put it. Everything that you're doing is definitely the entire medical community across the world, I'm sure, are doing their best to fight this and fight back. So what I'm taking away from this is our lives for the next year, year and a half are going to change. Basically, even when this starts to decline in a month or two, in my opinion, I could be wrong. Things will change. Masks may come about. We may be using hand sanitizer more until that vaccine is developed.
I think so, and I think some people have even said this will change how we live forever. Once you've been through a pandemic like this, as everyone feels right now, it's life altering. I think what we'll end up getting to is a society that really understands the importance of frequent hand washing. Masks, I think, to be determined. We'll see how that plays out.
Right.
But also really understanding that we have to be careful and we have to expect, even after we recover from this COVID-19, there may be another pandemic. I mean, this is really the truth of humanity as we develop and we grow and we have higher populations living in different areas of the world. And the fact that viruses mutate very quickly, there could very, very well be another one.
Okay. Well, Dr. Mayorga, thank you for your time. That was some excellent information.
You're welcome.
Really appreciate it. I helped inform our viewers as well as myself. I know you're a busy man, so I'll let you get back to running the Westerly. Doing what you do at the Westerly Hospital.
Thank you. It was a pleasure. Thank you.
All right. Thanks. Have a good one.
Bye-bye.
All right, everybody. Thanks for tuning in to Talk is Cheap with Shane B. We were talking with Dr. Oliver Mayorga, who is Vice President and Chief Medical Officer for Westerly Hospital, as well as Lawrence and Memorial Hospital. There's some great information. Share it with everyone. That was directly from the Chief Medical Officer from the Westerly Hospital. Information. I appreciate his honesty and how he was able to say there's we just don't know. So that can be frustrating. But as the doctor said, this at the time this is happening, in my opinion, this is a once in a century event. We have the technology to be able to, number one, communication. We can communicate with everybody very, very quickly. If you're watching this live stream, you understand exactly what we're talking about. The medical technology, our ability to sequence the genome, as the doctor said, this quickly has never happened before. So we're that much closer to creating that vaccine. So I do have to say, although we're going through this, it's a very difficult time. We will get through it. If we could pick any point in history to have to go through this, I'd have to say it's right now. So we have a long day ahead of us scheduled for live streaming. At 3 p.m., we have the local press conference from the town hall. We will be streaming that on Westerly Live and Westerly Live. At 7 o'clock, we have Barber with the Social Show. 8 o'clock, special episode of the Caswell Cook Show, which will be live at 8. And at 9 p.m., we have Rockin' On coming to you live from Phoenix Dining and Entertainment. Another show for you tonight. So stay tuned. Share all this information with all your friends. Get it out there. And enjoy your Friday. So for Westerly Life and Westerly Live and Talk is Cheap, I'm Shane B., reminding you to enjoy your Westerly life.